I was slightly off, and I was starting to get a tremor in my right hand. And so I went to the doctor, and that was the diagnosis, Parkinson's.
Of course, being a normal human being, you say, nah, that's not going to happen to me, but it did.
When I was diagnosed, I had a whole bunch of other plans that my life was going in. Well, the diagnosis changed everything.
I'm the kind of person that I have to do something when I encounter a problem. I have to do something about it, and this was an opportunity for me to do something about Parkinson's.
The more people they see, the more research that's done, they have to gain information. And I thought if they could glean one little piece of information, I'm up for it.
Well, I feel that it's everybody's responsibility to try to aid in any way they can, and I think this is one way of doing it.
It might help my grandchildren or children, and who knows, it might even help me.
The people you have just seen have a lot in common with you. Like you, they've been diagnosed with Parkinson's disease. Like you, they want to do something about it. And like you, they were asked to participate in research studies that could lead to better treatments, early diagnostic tools, and perhaps one day, even a cure. Studies which may help not just people with Parkinson's, but also those who are at risk for developing Parkinson's. Now you're considering whether to participate in one of our studies. To help you make that decision, we'd like to share some of the experiences of these and other study participants, as well as some thoughts from the medical professionals who are doing the research. The study we're talking about is being conducted by the Institute for Neurodegenerative Disorders, a nonprofit research facility in New Haven, Connecticut, dedicated to developing improved treatments and diagnostic tools for Parkinson's and related diseases. Collectively, our physicians and staff have decades of experience and are internationally recognized for their work in this field. The study you're being invited to join involves a unique technique developed by our scientists that uses SPECT brain imaging for Parkinson's research.
Brain imaging is, in its simplest sense, is a way to take a picture of a group of nerve cells in the brain. In Parkinson's disease, we know that a specific group of nerve cells is especially vulnerable. This is a group of nerve cells that make dopamine. What we're looking for is to see whether the activity of these dopamine nerve cells is reduced, as it might be in Parkinson's disease, and then we can use this technique to measure repeatedly how rapidly these changes are occurring over time.
Our objectives are really to develop improved treatments for the symptoms of Parkinson's disease, as well as to develop medicines to slow and perhaps even stop the rate of progression of Parkinson's.
And really the only way to assess that effectively is to be able to measure the disease process, and imaging is the best way to measure the disease process we have.
I think the first question to ask when you're considering being part of a research study is it safe?
The procedure's safe. We have a lot of experience in performing these imaging studies.
The nuclear medicine tests that we do are regulated by the Food and Drug Administration. This test involves more radiation exposure than a chest X-ray, but less radiation exposure than one would get from having a whole-body CT scan or a GI series. So it's well within the range of acceptable exposure.
Not only is the study safe, but it takes remarkably little of your time, only a few hours over a 2-day period, plus travel to and from our center. All travel, meals, and lodging expenses for you and a traveling companion are paid for by the research study. When you arrive at the hotel, you'll be given a study schedule so you can plan your stay here. Your first day calls for a brief physical and baseline neurological exam, followed by the injection of the radioactive isotope. By the second day, the isotope will have traveled to the area of the brain we're studying, so the scan can be done. Then you're free to return home.
When people come to visit our center for the imaging studies, everyone is actually seen by a neurologist. We sit down and answer any questions about the imaging, review the consent process, tell them more specifically what to expect.
All they do is take your blood pressure and blood tests and urine samples, that sort of thing. It's like going to your own doctor.
After that, we perform a neurological examination specifically for Parkinson's disease, asking them to do opening and closing exercises with their hands and finger tapping, as well as walking down the hallway, just as a baseline examination.
Then they do the injection, which is nothing more than having a blood test. I mean, it's exactly the same process, no pain.
I have much rather go through this procedure, the test, than take a flu shot. Because a flu shot leaves you sore and hurting and sick, and there's no after effect whatsoever.
What we're looking for is an area of the brain where the injected material, the radiotracer, accumulates. And in patients who have Parkinson's disease, we see less of the material being taken up into the brain because the nerve cells that would normally take that up are no longer present.
When you come in the second day, that's when you will have the scan.
It's not like an MRI. The only part of your body that is enclosed is the head, and you don't really even notice.
We put a little tape around their head just because it's very, very important to hold the head still. That's probably the most important part of the whole scan.
When the exam is done, I'll check everything to make sure the images came out okay.
Once you finish your scan, you're done with the clinical and the imaging part, and you're free to leave. We do call you in a week just to see how you're doing, make sure everything's okay with travel, with, number one, the way you feel.
From the time you leave home to the time you return, our staff does everything possible to make your travel and your stay as pleasant and carefree as possible, because we appreciate the contribution you're making to Parkinson's research.
You arrive at the airport and a limo picks you up and drive you to the hotel.
Well, when you come here, you do stay at this hotel called the New Haven Hotel, which is located directly across the street. The rooms are very comfortable. The staff is very, very accommodating there. The hotel is connected to the Temple Medical Building, so you can walk right across. You don't even have to go outside, which is very convenient.
Get to take in the sights of New Haven. There's museums and so forth.
We walked around, looked at Yale University. There's nice little shops around. It's like a vacation. It's 2 days where you have relatively no pressure. You eat in a wonderful restaurant and you talk to very nice people and you know you're getting absolutely wonderful care. It's a very pleasant experience.
Good afternoon, everybody.
The decision to participate in our brain imaging study is up to you. Talk it over with your doctor and your family. We hope you'll join us, because if you do, you'll be helping us take that important next step.
We are really on the brink of some very exciting new therapies for Parkinson's disease. We are reliant entirely on participants to help us to do this.
You should do it if you feel like you have any obligation to the general Parkinson's community so that you can advance research.
If they want me for something more, well, I'll be happy to participate because I know it may help somebody else as well as myself.
Consider the fact that people who have come before you face the same choice, and they have chosen to participate in a trial that ultimately resulted in a treatment that you may be on today, a treatment that may be helping your symptoms. This trial may or may not help you individually, but it will certainly help someone in the future.
I feel like a forerunner, Hopefully, what I'm doing will have some bearing, some impact on future generations.
I appreciate what they're doing, and it may not help me, but it might help somebody on down the line, and that's just what research is all about.
I see benefits to me personally and benefits to the Parkinson's population at large. How can you feel bad about it?